My name is Julianne Ehlers. I'm the NEMSIS Technical Assistance Center Program Director, and today we're going to talk a little bit about using the NEMSIS Cube to answer EMS questions. I've got an hour with you, and it's going to be jam-packed full of figuring out how to navigate the cube and look at all of this awesome EMS data that we have available. So NEMSIS is the National EMS Information System. We are the National EMS Data Repository. So NEMSIS, we collect, clean, store, and share EMS data from around the country and from also the territories. The thing that we're going to jump into today is actually a data cube, and it is, the way I like to describe the data cube is a powerful, multidimensional analytical database to collect, store, and share millions of nationwide EMS events. The term that I really like best for it is Magic Portal, because once you get into this, there's so much incredible data available to you that it kind of draws you in, and you kind of nerd out a little bit and want to see more and more as you go through. We start from the NEMSIS.org website. NEMSIS.org, easy to get here, easy to find, and you guys are welcome to jump on and follow along as we go so that you can get familiar with finding and logging in. But we'll go through all those steps, and also everything that we go over today, I will also give you the resources and show you some links so that you're able to repeat any of the steps that we go through today on your own. And this is a learn as you go process, especially if you're new to navigating a data cube. There is a little bit of a learning curve, so jump in. There's nothing you can ruin. So as you go through, try different things, ask different questions, build out those queries so that you're able to really investigate that data. So from the NEMSIS.org homepage, you're going to come up here to View Reports, come down to EMS Data Cube. That's going to take you to the landing page, and this is the EMS Public Data Cube. So what I'm going to show you today is public information, public data. You can access this anytime, anywhere, and it pulls together all of the data that we receive throughout the country. And there aren't, at this point in the EMS Data Cube, there are no state identifiers. We'll talk a little bit about how to get state-specific data in a little bit. So for now, let's get into the data cube. You should be here on the EMS Data Cube. Here's some instruction for you. Here's where we connect, and here's the username and password. NEMSIS public, NEMSIS@TAC is the password. But right below this, I'm going to show you some fun stuff. Well, I think it's fun. It is fun. We have fun. So the NEMSIS Data Cube video tutorials. Everything we go over today is also available in these short tutorials. They build upon each other, so you're not having to repeat how to log in if you just want to look at how to design a graph. So you've got those 5 different short tutorials on just specific things for accessing and navigating the data cube. Also below it, right here, is Data Cube resources. This right here, I love this. This is my favorite thing right now. The V3 Data Dictionary Supplemental Guide to the EMS Data Cube. If you're on your computer, I want you to open this so that you have this available to you. I've got it right here. This is what it looks like, and I'm going to show you how to use this to make your cube queries a little bit easier. So, NEMSIS Data Cube resources, and then this right here, let's open that up so I can show you. These are the national data elements and state data elements. I'll explain the difference in just a second, but this will show you which elements are available on a national level and which elements are available only to state level. And then the pink ones are some specific data elements that are available in the public research data set, but aren't in the cube right now. So if you've got a specific research question that revolves around something highlighted in the pink, then you can request the public data set. All right, let's go back to the cube. Let's go back to this page. So let me explain the difference between national elements and state elements really quick. So on the national level, there's a set of elements that all the agencies send up to NEMSIS. So there's national level elements, and then there are state level elements. So in addition to what we have established in the data standard as required elements, there are different data points that a state may require, especially if they are tracking something in particular that's not being tracked on a national level, or they have a specific project or something that is of specific need at a state level, but not necessarily at a national level. So there are some different data elements that a state can customize what they require from their agencies and from the field. So that's a little bit of the difference there between the state and the national elements. All right, when I get excited, I talk fast. So if you have questions, if you need me to stop and repeat something, you're just going to have to jump in because we get going pretty fast here. So we're going to open up and connect to the EMS Data Cube. I'm going to click on that red square, and I need to log in. So your login was given to you on that last page, NEMSIS Public, and it's NEMSIS at TAC, if I can spell it in right, capital N, and then at and TAC. So we're going to select Design, click up here, and choose OLAP Report. OLAP is the technology that we use to that's behind the cube. And we're going to click Connect to Cube. So here you're given an option for two different data sets, the NEMSIS V2 version 2 or the NEMSIS V3 version 3. So the NEMSIS V3 data is what we will dig into today, and it is 2017, 18, and 19 data. If you want older data, you can look at the V2 public data, and that is 14, 15, and 16 data. Today it's NEMSIS V3 for us, and I'm going to click OK. Now here's our main workbook page. This is where we will develop our query and filter, graph, do all of our fun stuff. You will always need a measure, so you expand summary measures and choose count of events. Now this count of events, we've got 60 million unique PCR records in the EMS Data Cube. These are not necessarily unique patient encounters, because as you're familiar with EMS events, you may have multiple agencies responding to a single patient. So this would reflect each patient care report, or PCR, that an agency completes and submits for a patient encounter. So at this point, for 2017, 18, and 19, you have 60 million records to look through. It's pretty incredible. And it's a lot of data, especially as you're asking questions and developing those queries. It's a great number to work with. All right, so we have our count of events selected. In this area, these are all of our measures, our summary measures, and then we've got data elements, and then underneath the data elements, we have all of these different data values. So there's a lot to choose from, and as you familiarize yourself with these data elements, sometimes you forget where things are, or you want to know if there's something in there that you're looking for. You can come back to, not that one, I'm going to close that one, this Data Dictionary Supplemental Guide that I had you all download and look at. Everything that is in the Data Cube is represented in this supplemental guide to help you figure out what is in each of those elements and variables. So if I'm looking at cardiac arrest elements and I want an idea of, okay, I can see it You know, we've got cardiac arrest, yes or no, some etiology prior to arrival, but I can come here and I can look at the different elements and see what's included there. You can go through and just click and open everything, and as you're familiarizing yourself with the cube, feel free to do that. But if you're trying to drill in on some specifics, use this supplemental guide to help you understand what is included under that element. So for cardiac arrest, these are going to be your options, the values that will be returned to you as you select that. No, yes, prior to EMS arrival, yes, after EMS arrival. You've got different options here. So every one of those elements that is represented in the cube, you're going to have a corresponding section in the guide that will help you clear up or better understand what is being reflected there. So we've got measures, elements, variables. Down here, we've got this 2x2 area for our rows, measures, filters, and columns. This right here, whatever we pull down into this will be reflected into our workspace. This is our results area. And then these are the icons. We're not going to go really deep into the icons. We'd need a whole nother hour, but it's totally fun. So as you dig in and start to develop your queries, don't hesitate to go in and check some of these out. All right, let's show you what some of this stuff looks like as we go through it. I'm going to pull up just some very basic information so that you can see how it's laid out and how to pull that information out of the cube. So let's start with dates and times. Anything with a plus, you can expand. And then these are your options. So if it has the little pyramid there, it is a hierarchy. So it's got parent-child relationship underneath it. So I can break it down to year, week, day. If it's got the rectangle, then it's just categories. So holiday names. I can look at all my calls on the different holidays. So for this, let's select this year. And if I click this box, you're going to see that everything I do up here, that everything I select is going to be shown down in rows and measures. Rows, measures, filters, and columns. So I've asked it to bring me back the year. Now I can see that it breaks down those 60 million breakdown for 2017, 18, and 19. This does not reflect the total number of calls in the entire nation. These are the patient care reports that were submitted during those years. So keep that in mind as we look at that data. And we're also going to, at the end, we'll talk a little bit about understanding and some of the caveats of raw data. So we'll get to some more detail on that as well. So I can see easily 2017, 18, 19, what records that I'm dealing with. This can be helpful when you are drilling down some of your variables into how to understand or how to delineate time frames for some of the things that you may be looking for. So let's just keep, we're going to just keep 2019. So if I want to pull out, I want to filter out 17 and 18, I can click here and either right click and add to filters, or I can do a drag and drop and add to filters. So I want to take out 17 and 18. I'm going to put a double check in this multi-select box, this blue drop-down arrow. I'm going to expand, and I just want 2019. So I'm going to select 2019. So now I've narrowed it down just to the 23 million records for 2019 that we have right now in the cube. Let's add another variable. Let's look at EMS response. So I'm going to expand EMS response. Let's see what we're looking for. Let's see what response mode to scene looks like. So if I just click the main box, then I have to expand it out here in my results area. Now I can see for my response mode to scene, it's got 16 million emergent, 400,000 downgrade, 7 million non-emergent, and 125,000 emergent upgraded. So that I can drill down just like I pulled out 2019. If I wanted to just look at emergent responses, I can do that. So I can drag response mode into the filter section and do the exact same thing that I did with year to pull out just my emergent responses. So now whatever I add to this query, I have drilled it down to be specific to 2019 emergent responses. I can look at any of these elements as compare to these. Keep in mind that as you add elements to evaluate, anytime you add another layer, it's going to slow it down a little because it's got to go and filter everything against those two variables that we've already given it. So 2019 emergent responses. Let's take a look at injury information. I'm going to pause for a second here, and we're going to talk just for a minute about ICDs, ICD-10. So in EMS coding, we use three or four different national coding systems for describing some of the elements, some of the data elements, and one of those is the ICD-10 codes. If you're familiar at all with ICD-10, there is a code for everything, and I mean everything. So if you want to see how many people were hit, no, it's my favorite right now is bitten by orca. So if you wanted to know how many EMS runs are related to bites by orca, you could look at that. They are enormous. The ICD-10 code list can be very, very specific. So as you're dealing with ICD-10, we also use RX norm for prescriptions, and we use SNOMED for procedures. So anytime you're looking at something with ICD-10, SNOMED, or RX norm, you have to keep in mind you are looking at enormous amounts of information with those codes. So the more specific you can be anytime you drill down one of those national coding systems, the easier this is going to be for you. And sometimes you have to go a little bit broader to get specific, and we can address that at the end as well. So I'm going to pull off response mode to the scene. So I'm just going to drag it out of my rows, drag it out of my filters, so that all I'm looking at is my 2019 runs, EPCRs. Now I'm going to add my injury information. If I click that main box, then all I get is this to expand, or I can just click this lower box and it expands it for me. You get this great little warning, and it's asking you, do you really want 1,900 rows of information? You can say, yep, I want 1,900 rows, give them all to me, and you can press that green go button. Or you can break the result into pages. You can do the show only top 100. And when I'm being really general in the beginning, I'll go top 100, and then there are ways that you can filter down a little bit more. So if I look at this, remember that I'm looking at just 2019, and these are alphabetical. The top injury cause ICD-10 name, so there's an associated code with each one of these, but right now we're just looking at the name. And I can see what the top 100 injury causes are for 2019. I can sort if I click count of events, and then look at what my top injury causes are. Not recorded means that it was actually left blank by the field clinician. So it may not have pertained, for whatever reason it was left blank. Not applicable means that the field clinician actually put in that, you know, this was not, injury cause is not applicable to this EMS event or EMS activation. So you can take those two right off the top because we've got no information for, that's 20 million of the runs that don't have injury information. But if we look then below that, we can see that fall on same level. Falls are always a huge, huge number for EMS events. Car accidents, oh, we've got another fall, and then another fall, and then assault by bodily force, we've got 100,000 of those, and then another fall. So as you can see, we've got several types of falls. So depending on the field software that the clinician is using, or depending on how it's coded, you may have many different options for a similar event. So if you're looking just to determine the number of EMS events related to falls, you would export this and you would combine all of your falls together so that you're not looking at so many different variables to those falls. But if you're wanting to get into fall specific, you could filter this and pull this just to look at falls. I'm going to show you how to do that real quick. So there's a second way to filter. I showed you this way right here, how we pulled away 2017 and 2019. Now I'm going to use this filter icon up here. Now in this, I need to tell it what to bring me back. And I have to be very specific that whatever is in the element field here is exactly what I'm asking it to look at. So ICD name is, you can see that here, ICD name for injury information is what I want. So if I expand that, it's not alphabetical, it actually goes in the order of the elements on the left side. So you have to look through, come down. I want injury information ICD-10 or ICD name. I don't want the 10 because that's going to bring me back code. I just want the name. Now I've got to tell it how to include the criteria, and I want everything that contains the word fall. So I'm going to type fall in there, and I have to insert that measure by clicking here. Click OK. It's going to take a minute to think. Oh, it didn't take it went fast. So now I've got all of this information just for falls. So if you're looking at something specific, some type of specific injury, you have to put yourself in the mindset of the EMS clinician and how they may be coding an injury in the field. So I had one, I worked with a group a couple of weeks ago that was looking specifically for postnatal hemorrhage. So postpartum hemorrhage, that's what it was. So we had to really look at all the different ways an EMS clinician would describe or code that type of hemorrhage. So it was interesting to go through and try and find the different ways that it may be described. As you develop your queries, think in the terms of an EMS clinician and all the different ways that they may use to describe something so that you can make sure you're pulling in every record that may pertain to your query. Oh, yes. Okay, so we've got a question. Let's show how to filter again. It went really fast. All right, let's take it out. I'm going to click on filter again and I'm going to delete it. So we're back to everything. So here's my top 100 injuries. I've got my car accident here again, and I've got my assault by bodily force, everything in there. Now, if I just want to look at fall, I'm going to click on filter rows. Here I need to tell it exactly what to bring back to me, and I have to be very specific when I select my element. So it has to match exactly the cause of injury, injury information, ICD-10 name. I'm going to select that. Now I can tell it to be an exact match. I want fall from bed, or I want whatever your specific thing is. Right now I'm still pretty general, so I'm going to click containing, and I want the word fall. So if it's any variation of fall, it's going to bring back to me. I'm going to insert that measure. If you ask it to filter and it doesn't do anything for you, it may be that you didn't insert this measure, and it may be that you would click another one of these. So you've got the parent and the child. So sometimes we ask it to filter the parent and it needs to filter the child. And so you just go back through and check that out. So I've got it in here in my MDX, and this is my instruction to the cube. And then I'm going to click OK. Then it's going to pulled out everything that didn't include the word fall. So I can go all the way down to specific. Let's see what's our. Let's see. We have 8 fall into fountain. So if you're super specific, or if you need to know what happened to people who fell from ice skates, you can get very specific. But if you just need fall information, we've got lots for you to look at. Now this is only 2 different levels of data elements, and we could go much further into this. So if I'm looking at non-moving wheelchairs, for example, I can look at age ranges, whether these were emergent calls or non-emergent. I can look at what procedures, what medications, interventions, how were they transported, where were they transported to. You've got tons of data elements available to you. All right, let's look at something else. I'm going to start over. So I can pull all of these off, or I can just come up here to New Report, click New Report, connect to the cube again. I still want V3, and OK. Let's give us a summary measure and a count of events. I want to see that 60 million back in my results area. Are there any questions? Oh, yes. All right, Eric. Dates and times. So I'm going to expand dates and times. I can choose, expand that. I can choose year specific. So I could come up here and do that filter row, but since it's such a basic filtering, I'm not going to bother with that. I'm going to drag this down into my filter section, and then it's going to give me this filtering bar up here. I'm going to double click on my multi-select, blue down arrow, expand, and I just want my 2019. Actually, we're going to look at 2018. So you can select and OK. So now I have filtered down to just 2018. Let's look at a vehicular injury. So I've got lots of different options in my injuries. We looked at ICD-10 names. You can add a code to that. Codes are very helpful if you are being super specific. But we're going to look at vehicular indicators. So I can put my check mark there, look at my vehicular indicator, expand there, and these are vehicular, pedestrian, or other injury risk factor. So what does that even mean? If I want to know what that means, then I can go to my handy dandy supplemental guide, and I can come up here and look at my 4-page long table of contents, or I can just do Control Find and find my vehicular. Here it is, on page 3 of the table of contents. I'm going to click to that spot in this guide, and it's going to give me some explanation on what is meant by this data element. So these are mechanisms or special considerations, field trauma triage criteria, specifically steps 3 and 4 as defined by the CDC. So you've got your bleeding disorder, thrown, run over, or high-speed impact, burn with or without trauma, ejection, telemetry data, which is very interesting, motorcycle fall, your different injury risk factors. To get even more specific about that, you have this nice little note down here, and you can link to the CDC guideline for field triage. And this will actually give you, there it is. So your steps 1, 2, 3, and 4 of your field triage. So especially if you're not an EMS field clinician that lives and breathes this, if you're doing some research into that and you want to understand how they're coding different things for trauma designation or that field triage, then you've got some helps in that supplemental guide. So now I have a little bit better understanding of what gets included for these risk factors. And look through here. You could drill down into just your injuries related to people who are pregnant, your systolic blood pressures, or your crash ejections. A lot of these are just provider judgment, where there wasn't a specific selection for risk factor, but the EMS clinician, based on their judgment or the combination of signs and symptoms, they have coded it as having risk factor. And so these help you understand too your trauma center criteria. So you've got that up here for another element. So let's go down that road a little bit. Okay, somebody with quick fingers, let's pick one of these to check out to see how they went, if they went to trauma center. So pick one of these off of the list. If you want your auto-ped or a burn, or maybe you want intrusion or a fall, pregnancy. Somebody get quick on their fingers. And all right, crash ejection, excellent. So we're going to filter everything else out. Since this is a pretty straightforward filter, I'm going to pull this down into my filter area. It's going to give me this little filter bar up here. I'm going to click multi-select. I'm going to give that little down arrow, expand, and now I can just select crash ejection. Or maybe I want all of them that have to do with motor vehicle. So I could select, however many I wanted. We're just going to choose crash ejection. So we're looking at 2018 crash ejection, partial or complete. We've got 13,000 records to look at that will help us understand those EMS activations. So now let's pull on our trauma criteria. Let's do this instead. I can look now and see in 2018 if it was a risk factor of crash ejection, partial or complete. Now I can look at the trauma center criterion. And these are very standard trauma center. You may have some Arizona specific for your trauma center criteria. So you can look at what is generalized for the nation. Again, not applicable. That means the clinician physically said trauma center does not apply to this call. Not recorded means that they left that field blank, but I've got, that's going to be my highest number, is my GCS of less than 14. So in 2018, with my crash ejections, partial or complete, I've got 1,700 records to look at, or I've got 1,700 events where their GCS was under 14. Now I can add medications, procedures, where they went, where they were picked up from patient situation or disposition. I can look at procedures and medications. Keep in mind for procedures and medications, you're pulling in SNOMED for procedures and RX norm for medications. I want to show you how to filter. Okay, we're getting down on the wire for time a little bit, and I want to leave some time for questions. Oh, not filter, export. So let's look at exporting what we have here. Anything that is shown on this screen in the data is what will export. You've got this export icon up on top. You have those choices for exporting the data, and we're just going to go plain old Excel. I'm going to select Excel. going to give me this warning sign over here. Ignore it. We're trying to figure out how to get that turned off, but in the meantime, just ignore it. But it downloaded some data for me. I'm going to double click that and open it. Yes, I trust it and want to open it. And now I've got in an Excel spreadsheet that basic data. When you are dealing with large lists or multi-factor lists, exporting and then manipulating in your data in your program of choice may be easier. I love Excel, so if I've got to do any data manipulation or if I want to do graphs and charts, my knee-jerk reaction is to go to Excel. You've got that option. There's a lot you can do within the cube itself, but then when you need to be a little bit more specific, export it, and then you're able to adjust those a little bit, or pull out things that don't apply, and be a little bit more specific, especially if you're looking at frequencies and comparing things. I also recommend that you screenshot some of what you're working on. Oh, can you guys even see the? Let's see if you can see it. Oh, you should be able to. Okay, now you can see it. I don't know if you saw that before. So this is what it looks like in your Excel. What I will do, I'm going to go back and show you back to that main screen. What I will do is I will screenshot this right here and then paste it onto my Excel so that I know exactly how to recreate what I have developed. So if I need to go back in. All right, let's see if I'm not sure if you saw that. This is what I'll screenshot right here, or sometimes I'll do the whole page, depending on how in the weeds I got. I'll do a screenshot so that I can make sure that I can recreate that query if I need to go in and change a variable or something. Let's start from scratch again, and then I'm going to show you graphs. So I started a new report, count of events. Let's look at something that is not injury related. So let's go to patients. I'm going to close those down. And you guys can jump in if there's something specific you want to see. I really will pull it up for you. Patient situation. Let's expand that. I have lots of different options for patient situation. Let's look at chief complaint organ system. So here, just very generalized organ systems. And you can see from not applicable and not recorded that not all agencies require their clinicians to complete this field. See, we have a whole lot of, okay, we've got a whole lot of GI issues. Let's filter out to just look at those GI issues. I'm going to pull that down into filters. Double click. You guys are going to be so pro at filtering. Now let's just look at GIs. All right, so now I've got 1.9 million EMS activations for GI complaints. How many of these were transported? Let's look at emergent versus non-emergent on these. So I can come up here to my EMS response, expand that. Let's see what they looked like. Response mode 2 scene. So this is this lights and sirens? Is this non-lights and sirens? Emergent downgraded, emergent upgraded? Gives me some of those different options. Let's filter this out and just look at our emergent response. I could also look at dispatch reason. Dispatch reason is always interesting because it's fun to see what things get dispatched out as and then what they actually are once EMS has had a chance to evaluate the patient. You know, as we know, our terrific dispatchers are limited to dispatching out only based on the information that they receive. So sometimes it's quite different than on scene than what it was dispatched out as. So I've got emergent. I have all my options here. Now let's see what that looks like transported from the scene. I'm not going to filter out because I want you guys to see what this looks like. Now I've got the option of, these are my GI complaints. I've got emergent. This was their response mode to scene, lights and sirens. So how many of them, let's see, they started out lights and sirens and they transported from the scene non-emergent, 800,000 of them. But 300,000 of those events actually stayed emergent. We've got our upgrades and our downgrades as well. But now you can see why sometimes it'll take a little bit longer. It's not going to go down for me. To show some of the different options with extra layers of variables of those elements. If I'm going to change that to where it's just all I did was click the parent code or the parent box instead of the child. I'm going to expand emergent. Now, if I were to export this like how it is now, this is exactly what it would look like. These would just say all and could not be expanded. So I would see these numbers, I'd see these numbers, but it would just be all. If you want each of those to export, then they need to be expanded before you export them. I am going to pull off transport mode from scene. I'm going to filter this down a little bit because I want to show you real quick how to do a graph. No, let's do response mode to scene. So response mode to scene. I'm going to take off from scene. And I just want response mode to scene. So this is what I want to filter here. And I want emergent. And then I am going to put transport mode. So now I can look at what happened with those after they responded emergent, and then what it looked like when they left the scene. And we're going to throw a graph on that. So you've got a chart option up here. You have lots of chart choices. And you can adjust some of your colors. So you can have some of your different color palettes. And let's go with just a basic pie chart. All right, let's make it a little bit bigger. We can adjust this depending on how you want it to look. This will not export. You can screenshot this and use it as a picture, but if you want this in a different format or manipulatable, then you export your data and develop and build this graph in Excel or your program of choice. So you've got lots of different options for your charts. Or you can, just depending on what visualization you would need to tell the story that you're working on for the query. All right, we have gone through a lot and we went fast. So are there any questions of things that you want me to repeat while I've got you live? Otherwise, I'm going to give you some other tips and tricks for navigating data in the cube. All right, state specific, excellent. So we've got a question on show you how to narrow down to an individual state. So the state specific is restricted data and has to be requested directly through the EMS data manager, because in the state specific data, it gets down as specific as agency level and zip code. So the states have requested to be able to monitor who has access to that data. So all of the things that we've done in the data cube right now can be state specific. You just have to make that request directly through the state data manager. I will tell you the best way to make those requests is to be as specific as you possibly can. The hardest part of developing these queries for research is understanding all of those variables that you want to narrow in your query to. So So my suggestion is always to develop that query to the national level with what you can see here, and then be very specific when you make that request for state level. Now, if it is agency specific, zip code specific, things like that, all states are pretty cautious about releasing that type of information. So you're going to need to be specific about what you want, and also be specific about what it's being used for. All right, that gives us state-specific data. One of the other things that we need to talk about just for a minute is some of the caveats of raw data. Numbers don't tell the whole story. So as you have developed queries or done research in other areas, just the plain numbers or frequencies or some of the different occurrences that you can extrapolate from the data, they don't necessarily tell the whole story. So you have to apply that logic as you are developing your research questions, so that when you share them with others, they understand what the parameters of that information are, what the and what the drawbacks are. So not every agency requires the exact same level of documentation. You've got the different elements, as we discussed earlier. You've got those national elements, you've got state elements, and then you also have agency specific. So keep that in mind as you are looking at this raw data, and being sure that you develop and explain the whole story and understand those drawbacks as well. I'm going to show you, as you're thinking of questions, if you have any, go ahead and ask them or type them in the chat. I'm going to show you some other cool things for your research-minded exploration. If we go back to that NEMSIS main page, you've got reports up here. Now this is where we found the data cube, but you've also got some other reports. And let's look at public reports, and I'm going to click on version 3 dashboards. Now these dashboards, these are public level, and there are state level dashboards as well. So if you need those specific visualizations or information, you just work with your state data manager on that. But these can show lots of different things, lots of different elements that are pulled together to tell a certain story. So we utilize Tableau dashboards, if you're familiar at all with those, and they're very robust. You're able to do quite a bit in there. So this is just the performance measures. So right now we are tracking, well, not tracking, but we are have a visualization for 3 different performance measures: blood glucose, stroke, and pain assessment. So let's look at, I'm going to change that to pain assessment. And this shows us our data set size. So I've got 7 million activations that have a pain assessment. I've got 9,000 EMS agencies, 51 states and territories. So my overall percentage is 57% of my PCRs with an injured patient have recorded a pain assessment. Now you can go down here and you can narrow in a little bit on specific things that apply to your area. So maybe let's choose South. If I click this, then it changes everything as it goes through. Sometimes it takes a minute. Each one of these variables will adjust that overall performance measure. So I can change geography. I can look at urbanicity. I can select if my agency is mixed, non-volunteer, volunteer, organization type. So you can build out what is specific for what you're looking at, and then as you select each of these, it will bring in this pain assessment for this particular measure, pain assessment of injured patients, 59%. The performance measure one especially is helpful when benchmarking, when trying to establish what is normal activity and where you fall in with that type or with those numbers. I'm going to come back to Stemi. Stemi is another one that you can look at. Naloxone is very well used right now, especially with all of the opioid tracking that we're doing. So naloxone, and then you've got motor vehicle crash. Some of these are very robust with the sets of included data that help to draw a picture of what those look like. Generally, if it is loading for very long, if you'll wait a few minutes and come back to it, sometimes it's a process of a lot going on at the same time. And then data quality. So you've got dashboards available to you, and you can print those as PDF or export them as well. There's public dashboards, agency level, vendor level, there are state level ones as well. What definition is used for rural? Oh, that's a really good question. I'm going to show you how we find that. Okay, so if we come back to our EMS Data Cube supplemental guide, I'm going to look for urbanicity. So we can narrow down, I'm sorry, I should have repeated. Okay, the question was what definition is used for rural? And we use, I'm going to show you where we find that. So here's the geographic regions that you can narrow that data down in the cube. So that's about as specific as you can get without going state level. So urbanicity is one of the filters that you can use. And we use the 2013 Urban Influence Codes. So if it is an external source that we are using, then we will give that, that reference or that link for you. So we can come, I'm going to open that up into a new. So the urban influence codes that we use are straight out of the Department of Ag Economic Research Service. Here are the codes here, and then for counties. So you can go through these and look through to give those specific definitions for urban, rural, frontier, and do we offer wilderness? No, we don't. Frontier, rural, suburban, and urban are the four that you can drill that down into. As we come to a close, let's go back to, I'm going to show you we'll go back to the main page. There is a ton of data for EMS research. There's just an enormous amount to help support so many different data initiatives. So if at any point you need additional help, I promise that as you get into this and dig around, you're going to hit a brick wall and you're going to be like, ugh, you're going to need some help. I want you to come to the support page of the NEMSIS website. And you've got a whole bunch of different options here for accessing somebody at the Technical Assistance Center. My information is right here. You also have just the general phone number and email, and we work really hard at making sure that your questions get answered in a timely manner. So I'll also put my email address down here in the bottom on the chat. So if you've got any questions as you go through your data, as you try and dig through, sometimes you just need somebody else to talk through, here's what I want to find out, how do I describe that? What measures are going to apply here? Help me see this in an EMS perspective, because depending on what your view is, if you're public health, if you're epi, if you're trauma, you know, we easily get stuck in our own views and need to sometimes have that sounding board to be able to put it into an EMS perspective for that data. Please don't hesitate to reach out at any time. This program is being recorded and it will be put up on the calls and training site. So we do a lot of different public trainings, and it will be placed in here actually as a public training. There's a whole bunch that we have coming up. Ooh, flu surveillance tools tomorrow. That one's going to be cool. You might want to jump in on that one. The calendars are right here. They have information for jumping on those training sessions. And the one today is going to go right here above using Tableau dashboards. That's a really cool one. Kevin White did that one for us, and that one's very interesting for the dashboards. So there is lots to dig in as you go through and discover this tremendous resource of EMS data. I want to thank Terry. He worked really hard to pull all this together, do a great brochure, promote it, and we are just happy to help with anything we can as you have EMS data research questions or queries. We're happy to help.